UroMonitor Catheter-Free Ambulatory Cystometry is feasible, safe, and well tolerated. An update, presented by Brendan Frainey. Since its popularization in the 1960s, urodynamics has remained the gold standard for functional assessment of the lower urinary tract. While multi-channel urodynamics can provide a great deal of objective data, it is not without limitations, including reliance on transurethral and transrectal catheters, non-physiologic nature, and inability to reliably replicate patient symptoms. We have developed the UroMonitor, a wireless catheter-free ambulatory cystometry device. The UroMonitor uses low-power flexible electronics housed in a flexible medical-grade silicone, allowing it to curl into a pigtail shape after insertion. Key internal components include a flexible circuit board containing a telemetric antenna and pressure sensor, as well as a rechargeable battery. To deploy the device, the UroMonitor is straightened and inserted transurethral similar to that of a Foley catheter. A pre-placed silk suture is secured to one of the end caps to aid in transurethral retrieval from the bladder. Once deployed, vesical pressure data is transmitted from the UroMonitor at 10 Hz and captured by an antenna secured to the subject's abdomen. This data is then relayed to a small pager-like radio receiver and stored on a microSD card. Data is also wirelessly transmitted to a nearby laptop using Bluetooth. This was a proof-of-concept pilot study testing the UroMonitor in 11 adult women with overactive bladder undergoing multi-channel urodynamics. Exclusion criteria are listed below. Our hypotheses were twofold. First, we believe the UroMonitor pressure data would correlate precisely and accurately with that from multi-channel urodynamics. Second, we believe the UroMonitor could be safely placed, well tolerated, and easily extracted from all study participants. From these hypotheses, we developed 3 study aims. Aim 1 was to assess the accuracy of UroMonitor recorded pressure data compared to multi-channel urodynamics. Aim 2 was to assess the safety of the UroMonitor. To do this, a post-procedural urine culture and heavy metal assay were obtained to evaluate for infection and to assess for battery leakage through the silicone housing. Finally, Aim 3 was to assess the tolerability of the UroMonitor. This was done by obtaining patient-reported pain scores throughout all study phases. On the day of the procedure, we performed a baseline urodynamics. The UroMonitor was then deployed and cystoscopy was performed to confirm appropriate device placement. Throughout all study phases, patients rated their pain between 0 and 5 using visual analog scale. Next, a second experimental urodynamics was performed with both urodynamic and UroMonitor pressure data recorded simultaneously. After this, urodynamics catheters were removed and the subject was allowed to ambulate and void in privacy with only the UroMonitor in place. A urine culture and heavy metal assay were sent from a voided specimen and the UroMonitor was then removed. All patients were called at 48 hours to assess for pain and or changes in lower urinary tract symptoms. 11 women met criteria for inclusion in the study. Mean age of study participants was 65 years and the mean BMI was 30. Mean time to insert the device was 24.5 seconds and mean time to extract was 2.1 seconds. There were no significant changes to baseline voiding behaviors at 48 hours. 2 patients did void the device out, but a second sterile device was able to be inserted, allowing both subjects to complete all study phases. The most painful portion of the study intervention was flexible cystoscopy, with a median pain score of 3. Pain during the ambulatory phase, with only the UroMonitor in place, had a median pain score of 0. In terms of safety, there were no study-related complications, no post-procedural UTIs, or detection of heavy metals within the urine. In order to determine if the presence of the UroMonitor would alter lower urinary tract function, we compared baseline urodynamic data to that from the experimental urodynamics with the UroMonitor in place. As you can see, there are no significant differences between any of the listed urodynamic parameters. To qualitatively assess the accuracy of the UroMonitor, we performed a side-by-side comparison of pressure tracings generated from urodynamics with that from the UroMonitor. As you can see in the representative figure, the top row displays the intravesical pressure, or PVES, obtained via a transurethral urodynamic catheter. Just below this, the UroMonitor recorded pressure tracing is depicted. All pressure values are reported on the x-axis in centimeters of water, and all urodynamically relevant pressure events were annotated with color-coded dots as seen here. The bottom row, labeled B, depicts UroMonitor recorded vesical pressure data during natural filling and voiding in an ambulatory patient free of catheters. In total, there are 87 urodynamically relevant bladder events identified. The UroMonitor accurately detected 98% of all events. We also analyzed the mean of the differences between urodynamic and UroMonitor recorded pressure data. 9 of 11 patients were included in this analysis, with subjects number 4 and number 6 excluded due to inadequate UroMonitor data quality for comparison. As shown here, the mean of the difference between urodynamics and UroMonitor recorded pressures was plus or minus 1 centimeter of water, with 94 to 99% of all recorded pressure differences lying within 2 standard deviations of the mean. In terms of our preliminary data from the catheter-free phase, subjects had a mean ambulatory time of 60 minutes. All subjects were able to void with the UroMonitor in place. There were 71% fewer detrusor overactivity events noted during the catheter-free phase when compared to baseline urodynamics. In conclusion, the UroMonitor is the first device to enable catheter-free telemetric ambulatory bladder pressure monitoring in humans. The UroMonitor appears to be safe and is well tolerated by patients. The UroMonitor can be easily inserted and removed via techniques known to urologists. Preliminary data suggests the UroMonitor can reliably identify urodynamically relevant bladder events. Thank you.